Karen. I would just like to introduce you all to Karen Denton, who's our resident expert on all things visual. Karen, as some of you know, and you might not know, is very experienced. She came to vision research via her nursing career and her fact that her daughter had diabetes. And she's probably the most knowledgeable person I know about vision in the aging eye and in the diabetic eye. And there's anything that Karen doesn't know, she will look up for you. So over to you, Karen.
Thank you. And as you know, just to remind everybody that Claudette and I are with Retina South Africa, where we do provide a whole host of services to patients with retinal disease. And this really is a widespread variety of things that we do for people. And we're very proud, actually, that we are very effective, even though, including our volunteers, we are a very small force, but with a major impact. And there, Claudette and I are in fact, here we were at a conference, I think, Claudette. I'm also affiliated, and I'm one of the founder members of the Low Vision Center of Learning, where we also do lectures for people with visual problems. I do have to acknowledge that our education activities are supported by an unconditional educational grant from Bayer, South Africa. And today, we're going to talk about some surprising things that you might not know that you don't know. So let's have a look at this. We are going to look at what may be overlooked with regard to eye health and especially age-related macular degeneration. Right, we're going to start with iron. Now, we know that iron is needed in the body, but it has been found that the retinas of people with macular degeneration have more iron in them than patients who do not have macular degeneration. We also know that people with diseases that cause an increase in iron in the body, for example, hemochromatosis, develop macular degeneration at a remarkably early age. And people with iron in the eye following an accident, sometimes welders and people like that get a little bit of iron into the eye, and almost within a few weeks or months, they develop macular degeneration. So iron can be a problem. But what about dietary iron? We keep being told that we need it, and we get dietary iron in beef, red meat, in fact, clams, potatoes, beans, lentils, spinach, and in fortified cereals. They always say fortified with iron. We also get iron in different supplements, and there are supplements on the market that include multivitamins with iron as well. So just beware of those and be careful of them. And as we mentioned earlier, many foods, including those breakfast cereals, contain iron. So if you have a macular problem, you might need to be careful. Also remember that red meat, as we said just now, is very rich in iron, and about 50% of this iron is absorbed compared with only 10% in vegetables. So that is the big difference between eating red meat and vegetables, because vegetables you will only absorb 10%, whereas with red meat you will absorb half of that iron. So if you have macular degeneration or have a propensity to this, just be careful of that red meat. We're going to look at red meat in a little bit more detail in just a moment. We also know that you have decreased absorption of iron if you take antacids, also decreased if you have calcium, magnesium, or copper, and these are found in chives, dill, and in basil. So that will lower your absorption of iron. So if you have a macular problem, these are good products to include into your diet. And you get up to a 90% decrease with coffee. And we will look at coffee in more detail as well. But you get an increased absorption if you take extra vitamin C. So especially when the flu season comes around and everybody rushes for their vitamin C, just be very aware that it is going to increase the absorption of iron from any of the sources that we spoke about. So what is your solution then? What should a person do? What should all of us do, in fact, the moment we are over 50? First of all, we need to eat fatty fish. And there are lots of them, varying in price on the market. There is salmon, sardines, tuna, and then mackerel and pilchards. Pilchards are a wonderful source of fatty fish and are very, very inexpensive. You get these tinned ones at all of the supermarkets for a really low price, and you can do all kinds of things with them. Obviously, it's very important then to limit red meat intake because of the iron that is contained in it. And then it is important also to monitor your supplements. If you're taking extra vitamins, if you're taking any of these things, especially if they contain iron, just double check with your healthcare professional that this is going to be safe for you. Then in the future, we know that obviously if iron is implicated in retinal damage, removal of that iron from the retina may just be wonderful at protecting the retina from further damage. And we also know that there are drugs that are available and that they can remove iron from the cells. But we need clinical trials to determine how safe these are, specifically in the eye, and how effective they will be in the eye. And as far as I know, those trials are very, very early, if they have started at all. But meanwhile, choose your foods and supplements very, very wisely. We're now going to talk, as we said, about coffee. Now, coffee gets all kinds of press. It's good for you, it's bad for you, don't have it, do have it. So let's have a look at the facts. What the medical published literature and research has shown. There are many studies in medical journals that have shown that 1 to 2 cups a day of, and this is proper coffee made with beans, so that would include things like the capsule coffees, like Nespresso and those, enhance the effect of your healthy diet. They contain a product called CLA, which is conjugated linoleic acid, and it's an antioxidant. And that is wonderful, absolutely wonderful at protecting the eye from damage from things like nitric oxide that moves in there and just wipes out the eye. So in other words, coffee is a very good protector of the retina. We know, as I've just said, that CLA destroys that nasty nitric oxide. And in addition to that, it inhibits iron absorption. But in all things, notice that I said 1 to 2 cups daily, and don't overdo it, because I know that a lot of people tend to think, and this is with tablets as well, 2 work well, so 4 will take better, so maybe I should take 6 or 8. That is not how it works. 1 to 2 cups daily works well, and overdoing it, you could just be tipping the balance in the opposite direction. So don't overdo it. Now, avocados. Avocados are an absolutely wonderful product, and they are now hailed as one of the magic bullets in health. There's a huge trend worldwide, partly because of the flavor and partly because of the amazing health benefits. There are some antioxidants, in fact, that are only available through diet. And guess what? Avocado has lots of them. In addition, avocado contains lutein and lots of it. In fact, in an avo, you get 80 micrograms of lutein. And in the best preparations that we have on the market today, there's only 10 micrograms. So you would have to have 10 of those tablets a day to match one avocado. Lutein is a very powerful antioxidant, and as I said a moment ago, antioxidants really protect your retina from damage, from all those nasty things that move in and try to destroy it. So lutein is wonderful. And interesting, avocado also helps the eyes to filter blue light. And we know that blue light, we're going to talk about it in a moment, is very damaging to the eye. So if we look even at a quarter of an avo, there's 256 kilojoules, so that's not too bad. 6 grams of monounsaturated fat. That is wonderful. Monounsaturated fat goes in, and it's like a vacuum cleaner that goes along your blood vessels and clears up all the little fatty deposits, the cholesterol deposits that are accumulating there, and cause that blood vessel to block and cause amputations, strokes, and obviously major damage to the eye, heart attacks, all the things that we know. In fact, in quarter of an avo, there's less than 1 gram of sugar. And they're 5 grams in a teaspoon, by the way. They're about 3 grams of fiber, which is very, very good for you. And then, as I said earlier, a whole host of vitamins, C, E, K, B6, riboflavin, folate, also potassium, magnesium, and pantothenic acid, beta-carotene, and omega-3 fatty acids. So who could ask for more? You've got your entire pharmacy in one product. So how's that for something wonderful? And we are blessed in this country that we have a major avocado industry. They are available everywhere. I said I would talk about blue light, and we referred to blue light a moment ago. Blue light is very damaging to the eye. And this is because it is a very short wave. And because it's such a short wave, it penetrates directly into the eye, directly onto the retina, where it starts to burn the little light sensitive cells. Now, we all know that if you look into the sun, you're going to burn your retina, and you're burning your retina because of the blue light. If you look into anything with blue light, you're burning the retina just a lot more slowly. But it's not surprising then that Claudette and I will both tell you that we are picking up children who are on their devices all day long, especially during lockdown, when all schoolwork was done on computers and tablets. We are picking up major problems with these kiddywinks. So this really needs to be addressed with some urgency. And it's not surprising that you very often see people who are on a computer for a long time. Their body's telling them you just can't cope anymore. And they start exactly as this picture shows. They close the eyes, rub the eyes, and just feel absolutely terrible. This is the body telling you that things are going very wrong in the eyes. And if you see somebody doing this, you know they've had an overexposure to that blue light. So as I said, smartphones, tablets, computers, everything is based on blue light. So our exposure to these really needs to be limited. But there are very simple ways to protect your eyes from these. You can hold your device at an angle, but a lot of people, especially if you already have a visual problem, find this a little bit awkward to do. You can wear blue light blocking glasses, and you get those, for example, the yellow clip-ons. They're not expensive. You can wear those when working on a computer or a device, and you can use the screen filter, or if you go into the App Store, there are all kinds of free apps that will block blue light. You just have to Google blue light block, and it will come up. I think I've got about 4 or 5 on all of my devices, just to get a different look each time. And then take advantage of those comfort view settings, and always reduce the glare from your screen. Use it at the lowest glare that is comfortable for you. And you can sit far enough away from, for example, the TV, your computer, or anything like that. This brings us on to another product, and this is a really nasty, vicious product that runs around in the body It is a byproduct, in fact, of protein metabolism, and it is extremely toxic to the body and is one of the major causes of macular degeneration. Homocysteine moves in there and is destructive throughout the body, including to the eye. So if we look at homocysteine, as I said, it's a byproduct of protein metabolism, mostly in meat and dairy products. So if you're having any meat or dairy product, you are putting yourself at risk. We also know that in our diets, the only way to combat this is with things like vitamin B, B12, and folic acid. And luckily, you can get these all in one, B6, B12, and folic acid, and they will metabolize the homocysteine very quickly and get it out of your system. So if you are taking supplements, just make sure that vitamins B6, B12, and folic acid are included. They very often are, but just double check for your own safety, especially if you tend to have a high protein diet with lots of red meat especially. So if we look at homocysteine, and if the levels start to rise in the bloodstream, and it in fact only takes one chop or one piece of steak to raise the levels in the bloodstream above normal, you start to get scarring of the endothelium. That's the inner lining of the blood vessel. So the inner lining of the blood vessel becomes damaged. And wherever you have that damage, you get lipid accumulation. In other words, you start getting those little cholesterol plaques forming. And the moment you get those cholesterol plaques forming, you get these atheroma, which means it's this lump in the blood vessel that is eventually going to block that blood vessel, and I'll show you. But even more important is it increases VEGF between 4 to 8-fold. And VEGF is what causes the extra blood vessels in the eye to grow and proliferate all over the place. And those little extra blood vessels rupture, they bleed, they leak, and they lead eventually to blindness. So VEGF is very, very different, and that's why we have anti-VEGF injections to try and stop this. So this is just a picture to show you that the homocysteine injures the arterial wall, and you start to get this buildup of lipid accumulation, of fat accumulation. The cholesterol starts to accumulate, and the entire cardiovascular system is then affected, and eventually one or other of these vessels will block. If it's to the heart, it's a heart attack. If it's the brain, a stroke. If it's to the eye, you obviously are going to have a major visual impact, and that part of the eye can be blinded. If it's to the limb, it will be a risk of an amputation, and to the kidney failure, etc. So this is very, very serious. And it's all because of this nasty product, homocysteine. So to be safe, we need to eat lots and lots of brightly colored food. And we know that the most important products to counteract this are any of the green leafy vegetables. That's kale, spinach, beet greens, moroch, which is very popular in our culture. And funny enough, eggs. Now, eggs I'm going to talk about in a moment, because that's a story that people very often misunderstand as well. And it is very important to stop smoking, because smoking enhances the effect of homocysteine, and it also damages the blood vessels extremely. And then last but not least, alcohol in moderation. And we're talking about, I think people do understand what moderation really is. And then, as I said, if you can just take in those vitamin B supplements that we mentioned earlier, that is very important. 6, 12, and folic acid. Now, eggs. If we look at eggs, eggs had a very bad press for a very long time because it was felt that they contributed to cholesterol. But if we look at cholesterol and cholesterol, they are not all the same thing. If we look at the fat, for example, on a piece of steak. That is solid fat. The fat on a chop and things like that, it's solid fat. If we look at the fat in an egg, that is water soluble. You know that if you put an egg into water and mix it up, it dissolves very easily and mixes easily into the water. And it does the same in the body. The fat with meat and products like that goes into the body and into the bloodstream as those little hard fat particles. The fat from eggs, exactly as the same as it does in water, can mix into the blood as well. And as I said, it has been linked to lowering the risk of macular degeneration. Now, this was a huge, very long study in Australia that is now not only 16 years old. The original follow-up was 10 years, then 16, it's now 20. And they found that 10 years after following up on these people, that eating just 2 to 4 or 5 to 6 eggs a week was associated with a 54 or a 65% reduction in developing macular degeneration. Now, it doesn't matter how the egg is prepared. You can do it the way you like. It can be boiled, it can be fried, it can, as long as you fry it judiciously, it can be an omelette, scrambled egg. The only thing and the only advice is the yolk must be as soft as possible. So if you have a boiled egg, for example, not too hard. And if, for example, if you imagine a scrambled egg, not that it's all dried out and firm, a nice medium softish one. And as I said, 2 to 4, 54% decrease, 5 to 6 eggs a week, 65% decrease. And then even after 15 years and 16 years later, they published this, even 1 egg a week in a different cohort was associated with a 46% reduction in developing AMD. And these numbers have been sustained even 20 years later. So the answer then is obviously to eat, as we always say, from every color of the rainbow every single day. If you can include all of these colors in your diet every single day, you are doing your eyes and your general health a massive favor. So there's no such thing as phoning me or phoning Retina South Africa and say, please send us a diet. There's no such thing. You must construct the diet according to your taste, but then include things like the fish that we've spoken about, include all these colors, make it interesting, make it good looking. Try to enhance the brown and white diet that we're so fond of in this country. The steak and chips, the pap and wors, the chops and mash and things like that, that we really, really do enjoy. And that's fine. If you have those, just make sure that you have a plate like this as well. It is very important. Now I'm going to say a word or two about vitamin D, because this is another one of those things that has hit very hard during COVID, lockdown, etc., etc. Vitamin D is essential in the body for the well-being and the structure of every single cell in your body. Every cell in your body needs vitamin D to remain intact, to remain safe, and to protect that cell from damage, from infiltration, from harm, from invasion. So vitamin D is very important. And it is just very sad that vitamin D was labeled a vitamin, because in fact it isn't. It is a chemical that is required in the body. So why is it so essential? As I said, it's very important for every cell, including bones and muscles. It's incredibly important for your immunity. Without vitamin D, your immunity does break down. It helps to protect people from diabetes. It keeps those beta cells intact. And funny enough, the beta cells in the pancreas are one of the first things to suffer from lack of vitamin D. So if there's not enough vitamin D, the little beta cells that make insulin start to break down very quickly, and they start to not be able to produce the insulin the way they normally should. It also helps with hypertension, to control it, with weight loss. Did you know that if you take vitamin D in adequate amounts, and if your body has vitamin D in adequate amounts, you can stabilize your weight really well? It helps hugely with depression, and it helps to prevent people from cancer, heart disease, we've said diabetes, rheumatoid arthritis, inflammatory bowel. In fact, you name it. Vitamin D protects you because it is essential in every cell, and every cell is going to break down without it. And it has been labeled the superhero vitamin. In the eyes, we also know that vitamin D can protect from age-related degenerative conditions like cataracts, macular degeneration, and with glaucoma. So if you have a lack of vitamin D, you are putting yourself at risk for those exact problems in the eye. And so to protect yourself, make sure that you have enough vitamin D. But where do we get it from? The simple answer is the sun. But for some reason, people are scared of the sun, and we will go back to that in a moment. But there are some food sources of vitamin D, things like eggs, fish. Once again, we always talk about fish. It's a wonderful product, and green leafy vegetables once again. It's just that you need a lot more if it's a food source, and the most reliable source just happens to be the sun. But there are other sources as well. You can take capsules or tablets to supplement what you have. And one of the major causes that we have today of vitamin D deficiency, if you look on the top left-hand corner of the screen here, one of the biggest problems that we have today is the overuse of sunscreen. Now, the moment you go into the sun and you put sunscreen on, your body cannot absorb any vitamin D. So there is no benefit to going into the sun at all. Also, melanin. The deeper your tan, and I'll show you that in a moment as well, the less sun you're going to absorb. If you are at a high latitude, you have decreased absorption as well. Winter, you have decreased absorption. And obviously in areas of air pollution where the sun simply can't get through, you have increased blockage of vitamin D. And just a word or two about fake tans. And I put this in because somebody said to me the other day, no, they love going in the sun, but they put on fake tan and then they can still absorb vitamin D. No, you don't. And this is a fairly new study that I picked up in the last few days, that fake tans prevent your skin from absorbing vitamin D in exactly the same way that sunscreen does. So if you go into the sun, be very, very careful, because as I've said, this very important vitamin is essential, absolutely essential for our health, for the integrity and the functioning of your entire body, every single thing. But once again, too much is a problem. So don't think that one is good. I think I'll take, the doctor says 2, I think 4 will be better, so maybe I'll take 8. You stick to the recommended dose that your doctor prescribes. If it's 1 capsule a day, that's what you take. Elevated blood levels can lead to blood calcium levels that start increasing as well, and that then can cause a lot of kidney damage, nausea, vomiting, poor appetite, stomach pains, constipation, or diarrhea, or you can have both, a day of constipation, a day of diarrhea, bone loss, and I mentioned kidney damage, and too much can even lead to kidney failure. So we need to be very careful of too much. Now, the best source of vitamin D is directly from the sun. And the only thing you have to look at, and I do cover this quite regularly, is as long as your shadow is longer than you are, that sun will enter the body. It will provide vitamin D without causing harm to the rest of the body. The moment your shadow is shorter than you are, the way the rays penetrate can predispose to all kinds of skin cancers. So as long as your shadow is longer than you are, the angle is protecting you, but you are absorbing vitamin D really well. Obviously, if you don't cover yourself from head to toe in everything under the sun and no sunscreen, you'll be blocking it. You don't need sunscreen in the early morning and late afternoon anyway, in the hours when your shadow is longer than you are. So just look at your shadow. Is it taller than you are? Are you taller than it? And that can determine. Now, we're going to just say a word or two about macular degeneration, because we know that macular degeneration is rife in every country virtually in the world today. And we know that there are almost 200 million people in the world. And in our own country, the numbers are quite staggering. And this is added to by everything that we've spoken to, the incorrect diet that we have, decreased exposure to vitamin D, all the things that we have mentioned until now. And we know, for example, that we do have anti-VEGFs. This is for wet AMD that we spoke about the VEGF earlier, the blood vessels that form in the eye that can lead to blindness. The anti-VEGFs available in South Africa today are not all alike. But please remember that if one does not work for you, you need to change to one of the others. There are options on the market. And just to remind you that if you're having a problem with your medical aid, you can contact Retina South Africa and we will assist you at no extra cost to you for that. You just have to be a member of Retina South Africa and we will intercede on your behalf to get the proper, adequate, appropriate, effective medication for your eye. So if you know anybody in this situation, please tell them. I'm going to say a word or two about blood thinners because these are also important, also something that people are often very aware of. These are things like warfarin, Coumadin, Xarelto. Now, blood thinners, we have a very strict balancing act in the body because we don't want that blood to clot in the blood vessel because of the risk of heart attacks, strokes, clots forming, amputations, things like that. But if we have blood thinners, we are increasing the risk of hemorrhages, for example, in the eye. So what do? We have to balance that very, very, very carefully. And that is why your medical professional will guide and advise you really carefully about this. But then to confuse the issue, what about green leafy vegetables that increase clotting? Once again, continue with your optimal diet because of the other very essential benefits, but you need to check your clotting time very, very, very regularly. And your doctor will then guide you about the blood thinners that you are taking. But there is more to the story than just that, because if we look at the ARIDS2 formulations, and there are many on the market, and you need to check with your medical professional which is the best for you. Because, for example, we have MacuShield, Ocuvite, Retina Plus, etc., etc. And I'll just look at one of the examples. Ocuvite has Ocuvite Complete and Ocuvite Lutein. And people often say, but why am I on the lutein and not the complete? Won't the complete be better? It depends on your situation. Because Ocuvite lutein is prescribed if a person is on a blood thinner. Because if we look at the formulation of this, it does contain a product called vitamin E, which is very, very, very relevant to people taking a blood thinner. And the full amount of vitamin E is found in Ocuvite Complete, for example, but much less than half, a quarter of the amount only, is found in ocuvite lutein. And we know that vitamin E is one of the products that can increase the risk of bleeding. And this would be very relevant to people already taking ocuvite because of the risk in the eye. So that it's very important that anyone who's taking any of these products, any blood thinner, must only take the ocuvite lutein, the product with much less vitamin E in it, so that they don't have an unexpected bleed. Now, here's another product that people often don't know about, and that is a product that is used for gout. Allopurinol, which is marketed very often as Xyloprim and a couple of others. There's long been a link between gout and macular degeneration. But when they looked carefully at this and they started the research in this, they found, was this due to age, lifestyle, diet, etc., the macular degeneration, or was it maybe due to this product that they were taking? And interesting, they noted that when ophthalmologists stopped the allopurinol, that the exudates that were forming and causing macular degeneration started to disappear. So there's a lot of research still going on around this, and I'm sure they will work on a different product to try and establish what is happening there. I'm going to say a couple of words also about ibuprofen, because we're all over 50. And we also know that ibuprofen slows blood clotting time, so you can get increased bleeding with that as well. We also know that there are all kinds of increased risks with NSAIDs or non-steroidal anti-inflammatories. And we also know that we have a major problem here with VEGF in the eye, the product that causes increased blood vessel forming. We also have a problem with ulcers, strokes, heart attacks, hypertension, and especially in the aged, ibuprofen can cause sleepiness, confusion, dizziness, and can cause you to lose your balance. So if you're taking any of these products like Brufen, Nurofen, etc., be very, very, very careful and avoid them if possible, or take very, very small doses. Discuss this with your doctor to make sure that you're not getting into trouble by taking any of these products. Now, this is something interesting, and this is research that is still going on. We know that statins are what are prescribed for people who have a high cholesterol or fat. And we also know that the drusen that form in macular degeneration, those little deposits in the eye, are little cholesterol deposits, if you want to summarize it that way. They're little fatty deposits. So what they did, they gave people with these fatty deposits statins, and they found that they reduced the size of the drusen. The preliminary study showed that there was quite a significant effect, and at Harvard University then showed that giving high doses of any of the ones that they tried for 12 to 18 months showed that 40+% of the drusen disappeared. So nearly half of the drusen disappeared completely. And the people reported that their vision improved significantly. But we need further research to find out how this is happening, because you don't just want to give a product and then find that it has other side effects. So this research is continuing even now. But in the pictures that they took at the time, here is a picture of a patient, and those lumps that you can see that look like little tiny mountains are in fact drusen that are forming in the retina of the eye. And after using statin for a year, you'll see that that has flattened completely. Those drusen disappeared completely. But as I said, this research is ongoing, and we can look in the next year or two for the official proper studies to be published. This is just a preliminary study that was published. Now I'm going to speak to you about this gentleman. This gentleman had a massive impact on the world, and he is in fact the last person I'm going to talk about today. As I said, he had a huge impact. He was a laboratory man called David Brown, who was working on a product called sildenafil. It was originally developed for hypertension, and its side effect was then discovered accidentally when they were about to can the product completely, when they did research on a group of miners. The product was failing completely, and then David Brown stepped in, and he was interviewing a group of miners on a trial to see how this affected their blood pressure. And he then reported that when he asked the miners, have you noticed any other side effects? Is there anything else that you noticed that you would like to report? He actually had no expectations, because in the trials until then, there'd been no reply. But this time, one little person put up his hand and said, well, I seem to have more erections during the night than normal. And after a few moments silence, all the others smiled and said, so did we. And this was how they found that Viagra is a wonderful product, in fact, for the eye. In a 2-year trial that was led by Columbia University, they found that the little Viagra pills could, in fact, stop AMD from progressing. And in a trial that was published in the Journal of Ophthalmology in 2017, they reported that just 1 hour after giving the pill to people, that the retinal blood flow increased significantly. It could nourish the retina, it could reestablish what was happening detrimentally in the retina. And there was a huge difference in the central choroidal thickness and the retinal blood flow. So this was fantastic. This was fantastic news. And this effect was obviously due to the Viagra, just as it affects the rest of the body. And once again, this is another research that is still ongoing at the moment, just to discover if there's a way that they can tweak this in a way that it affects the active compound, can affect the eye without affecting the rest of the body, if that is what the patient wants. Maybe they don't. And on that very happy note, I would like to say thank you very much to everybody. And if you need us, I will go back to the slide to give you our details. But just to remind you that at Retina South Africa, we are part of the My School project. And to remind you that we can have 3 beneficiaries on the My School project. And if you would nominate us, there is no cost to you, but when you shop at different outlets, we do receive a few cents, and boy, oh boy, those cents do add up. Thank you very, very much.
Thank you, Karen, for that such an informative talk. I'm sure that all of you enjoyed it as much as I did. As I said, every time I listen to Karen, I hear some. But I would just like to reinforce your warning about ibuprofen. My husband is in his early 80s, and he had a tooth infection, and he went to the dentist, and the dentist gave him ibuprofen, and he has some cardiovascular problems, and he actually collapsed and in the garden and actually injured himself. He had to be taken to hospital, and they had to have a brain scan, because he fell on his head, etc., etc. So when we went to the emergency room, there was a very nice young doctor, and he said, what medication is he on? And I said, oh, blah, 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 and statins and this and that. And I said, oh, and recently he's been taking ibuprofen. And he said, ibuprofen should never be given to an elderly patient for those reasons that you said, unsteadiness and lightheadedness and all that sort of. And we were really very concerned about him. So I'd like to say to everybody, please be very careful about ibuprofen. So let's have a look. We have somebody in the chat.
While you're looking at that, I will just say that to me, I find it a bit of a pity that you can buy ibuprofen freely across the counter, although they always tell me it's because it's a lower dose. Yes, it is a lower dose, but people will then go and they will buy ibuprofen, and you get quite an inexpensive one as well, and they'll then take 2 or 3. Because, as I said, unfortunately, people feel that if one works, 2 will be better, so let's take 4.
And it's something we always say to people, especially people over the age of 50, be careful. Don't self-medicate. You don't know what those medications, how they will react with medications that you're taking that have been prescribed by your doctor. And that even, people go to a health shop and buy health products. So, they too can interact with all the medications that you need to take for your various health conditions. So please be careful. In our chat, Diabata said, a wonderful discussion. Thanks so much.
Thank you.
Gail says, really find your talk so informative. Could you please explain astigmatism at some time? So would you like to explain astigmatism?
We can. I actually cover it in the talk on art. Astigmatism is when the ball of the eye is deformed and you therefore see things in a slightly different shape. They either elongated in usually the vertical plane or in the horizontal or in any plane at all. And you normally need glasses just to correct that.
And perhaps I can add to that for
I'm
Gail,
sure you can.
to say that there are 2 types of astigmatism. You can have an eyeball that instead of being nice and round, it's more pointing, as Karen said, but you can also have perhaps the front of your eye is corrugated. And that is also a form of astigmatism. And you can imagine that corrugation, that roughness of the eye, will actually make the photons coming in to go to the retina to be not clear and sharp. So normally you can have astigmatism, as Karen said, can be corrected with glasses, or sometimes even with if you like to wear contact lenses. So I hope that works for you, Gail. And Leonora says, thank you, Karen, for a super informative meeting. I think you have to unmute yourself, Hugh, if you'd like to talk. There you are, Hugh. Welcome. Would you like to ask Karen a question?
Yes, I would. I was at Pilates and I bent over and suddenly I went blind in one eye and I rushed off. And about 3 hours later, I finished my treatment with Dr. Dinda, and in fact, it remained blind. Now, I have slightest peripheral vision, and I don't think I can do anything to restore that sight in the one eye.
Did your doctor tell you what it caused it? Because there are a few things that can cause this, a ruptured vascular detachment, different things.
He showed on his screen, he showed the smallest dot in the middle of a vein in the eyeball, and that stopped. And so we pounded it and pushed it and pushed it and pushed it, and we couldn't remove that little minute dot. So it was a sort of stroke in the eye, I think. There's a colloquial way of saying that.
Yeah, that could also be a cause, and I'm very sorry that happened to you. And yes, so you would just have to be very careful in the future and follow your doctor's advice in absolutely everything to make sure that this never happens again. What treatment are you on for this?
I'm on blood thinners.
Good.
And I cover them for the heart in case there's a problem there, but there wasn't. So I was checked out. I had the heart looked at. There was no leaking blood from around the heart. And it just seemed to be a one-off occurrence, which just happened because of the smallest buildup of cholesterol in the eye. So perhaps I should have been taking statins.
Yeah.
I think you said.
Okay.
Well, it's not registered as yet for the eye. As I said, the research is still going on, but but it is at the moment we can only say that these are early studies that they've done, and the rest is basically anecdotal, and it looks as though it works, but we are not allowed to prescribe something that is not registered.
Thank you.
So,
all right. Well, I've learned a great deal. We do try to follow your details of diet. I'm delighted about eggs that they've been reinstated, let me tell you, and I'm delighted at your beautiful color of all sorts of things. And we've taken to growing, indeed, and we've taken to growing kale in the garden, so we just need to get to using that more frequently. But thank you very much for this morning. I found it very informative.
Thank you very much, and thank you to everyone for being here.
Just to add to what you said, you know, that blockage prevents the blood getting to the retina, so the retina gets no oxygen. So the minute the retina gets no oxygen, it dies, because it's a very metabolically active part of our body, and it's subject to very prone. If it gets oxygen deprivation, it's very susceptible to damage. So if you watch your cholesterol levels, get your cholesterol checked regularly, it shouldn't happen again.
That's fantastic. And in fact, that is what Dr. Dindar said to me, that it was a starvation of oxygen, and that I'm afraid that he said we can do nothing more about it, and you just have to remain with your peripheral vision, such as it is, and trust the other eye is fine. But thank you very much for that.
Well, something that's coming in the future, which might be good for you, Hugh, it's a bit long way away. They're actually looking now at a brain implant, to actually implant an electrode into the visual cortex. So you wouldn't need that eye. You might be able to see with your brain. So who knows where research will take us.
I'm immediately frightened. Thank you very much indeed.
And I think we've got another one. I think, we've said from Lindiwe, says, I always have found something new every time I listen to your presentation. Thank you, Corin, for this informative talk. And I just want to say that Lindiwe is one of our social workers working with Retina South Africa, and they always tune in, and they are like sponges, her and Victoria, for all the information that Corin gets. They just absorb it, and we're just so thrilled that we have such dedicated workers in Retina South Africa. And Corin inspires us all on an everyday basis. So I don't think we've got any more. We're just on past, which is exactly an hour. And please remember our website, www.retinasa.org.za, and you can go there and see under Learn, look for webinars or podcasts, and you can see all the talks that we've done. And these include things like how to use your smartphone in a really smart way, and assistive devices if you're having problems reading. So please go and look and see. Okay, so we've got another one. Jennifer quickly jumped in. Do the green vegetables, example like kale, need to be eaten fresh stroke raw?
There are certain vitamins that do break down when cooking, but even cooked kale, cooked spinach, all of those things are very, very, very good for you as well. But raw in a salad is phenomenal. Yeah. So I would at this stage say, if you're not having those products, either way is good. Raw is very good, but cooked also has major benefits.
But just remember, cooked doesn't mean overcooked. Lightly steamed is the best way, and that means that sometimes the nutrients in those very tough vegetables aren't easily absorbed. So if you lightly steam them, it does free them, but don't cook kale or spinach for hours, because you will destroy the nutrients.
Oh, so that it's completely pup and limp.
So that was a very good question, Jennifer. So if there are no further questions, we're going to close this webinar with a very grateful vote of thanks to Karen and to all of you who show up and support our awareness. And we are going to have a big push against diabetes, and we will be featuring that a lot in our upcoming talks. So thank you, everybody.
Just before we leave, next month, I might do it a week later because that first week, Claudette, as you know, I'm going to be away. But I will send out the notification early as well.
Okay, so we will try and get the notification out in very good time. So thank you, everybody. And thank you, Karen. And all be well, be safe, and get your vax.
Absolutely.